And now we're going to switch gears a little bit to the dollars and cents questions that many counties have been asking about both realignment and in general. How can we tell if we're getting a return on investment from our public safety dollars? And so I'd like to invite Ashleigh Holand from the Pew Results First Initiative to talk about their work in California.
Thank you, Megan. Oh, story of my life. Here we go. Well, good afternoon. My name is Ashleigh Holand. I'm a senior associate with the Pew-MacArthur Results First Initiative, which is, as you may have gathered from our very creative name and creative logo placement, a joint initiative of the Pew Charitable Trust and the John D. and Catherine T. MacArthur Foundation. Last year, we introduced our state-based initiative to you here at the second annual conference on public safety realignment. That mission being starting out as to help state policymakers identify and to invest in what works in order to achieve better outcomes in criminal and juvenile justice and in a range of other social policy areas. So we introduced this state-based initiative to you here last year, and this year I would like to reacquaint you with the approach. I know you've been thinking about it all year long. Reintroduce you to it, to describe some of the ways our partner states across the country have been using the approach in criminal justice, and to invite you to hear from Santa Barbara County, which is our first county to sign on to the initiative, to hear the county perspective. Results First was born out of a critical policy challenge that we were seeing at the state level. Government leaders want to make strategic budget choices to make the best use of government resources, but in times of fiscal constraint often rely on incremental budgeting and across-the-board cuts. A lot of the time, it's politically easier to share the pain across agencies and across the program budget, but mostly it's because they lack critical information. Government leaders don't often know the breadth of the programs that their agencies are providing and at what cost. It's rare that individual programs have strong evaluation data, and we can say with certainty, providers can say what their programs are actually accomplishing. And leaders definitely don't have information about program alternatives and have data in hand about how similar programs might fare in their jurisdiction and at what cost. And it's not because it's too hard, and it's not because we don't know enough about programs, but it's just because we haven't harnessed the information that's available to us in a comprehensive way. Here in California, you're faced with a similar policy challenge. Counties are now responsible for new types of offenders who will be accessing your resources and enjoying your company for much longer periods of time. And you're having to make some real decisions about what programs to offer to them in order to meet their needs and to keep them from coming back. Results First is all about using data to help you make those difficult programming decisions. So how do we do that? Results First is using an innovative approach to cost-benefit analysis. So instead of running a cost-benefit ratio of individual programs that might have different time periods associated with them, the Results First model allows you to view all your programs, or a subset of your programs, through the same lens, enabling you to make an apples-to-apples comparison about very different programs. So I say model because that's essentially what you're building, a county-specific econometric tool that allows you to identify programs that work and how much those programs will be worth to you. So at a very high level, there are three main components to this model. First, it relies on an extensive national research base. Researchers at the Washington State Institute for Public Policy, or WISUP, have reviewed thousands of program evaluations and assessed them according to a very strict set of criteria for methodological rigor. So using only the best studies, they then aggregate those documented outcomes, resulting in a very clear prediction through meta-analysis, resulting in a clear prediction of a program's effectiveness or an effect size. Next, we play that effect out at home. Using your county's own populations data, you can overlay that effect size to get a good idea of what that program would actually achieve in your jurisdiction. So if a drug treatment program is expected to reduce recidivism by 11%, what does that mean in your county in terms of bed days saved and crimes avoided? Third, using the county's own fiscal data, we can then calculate what those recidivism reduction benefits would actually be worth to you, resulting in a county-specific return on investment statistic for each program in the model. So it's the best of both worlds. It's rigorous national research base, and county-specific populations and costs. So here's a more concrete example of how the model works using data from Washington State. Washington researchers determined that their juvenile population was recidivating at a rate of about 60% within the first 3 years and 75% 15 years later. Now, functional family therapy is a program that incorporates the family into the rehabilitative process. And through their meta-analysis, they determined that FFT reduces recidivism in this population by about 22%. Pretty solid. The model's work then is to calculate the benefits of that recidivism reduction, or monetizing this shaded blue area. Because when you're investing in a corrections program, what you're buying is skill building in the individual and associated outcomes, and you're buying recidivism reduction. And when you're investing in something, when you're buying something, especially something this expensive, you're going to want to know how much it's worth. So here's how much it's worth in Washington State. First off, FFT costs the state of Washington about $3,000 per family. And according to the literature, benefits accrue across a number of domains. Crime is reduced, and we can monetize that in terms of reduced victimizations in the community and reduced burden on the system. Participants are actually more likely to graduate from high school and have increased earnings to the tune of about $5,500, becoming taxpayers rather than tax consumers. And this program is actually associated with reduced healthcare costs per participant. Now, reducing all of these projections to net present value, taking your total benefits over time minus the cost to provide the program, Washington State determined that this program, FFT, is a pretty good bet for their state. For every dollar they're investing in this program, they can expect to receive $12 in benefits over the long term. Now, using this approach for several programs, they generated what we're calling a consumer reports style guide to programs in the state. You can do the same thing here in your county, creating a list of programs that ranks them based on the costs and the benefits that each program is expected to generate for your taxpayers and for your society. This allows you to move beyond just having a list of programs and what they might cost to operate, where an expensive program might scare us away and an inexpensive program might look like a good bet, to taking a closer look at what your investment would actually buy for you in the long run. To making strategic choices for your county's program dollars that takes into account the long-term costs and benefits associated with each program. Filling that critical information gap and going a step further to provide you with county-specific investment advice using your own populations, how your people behave, your own costs to provide each program, and your own county-specific costs to provide all of these criminal justice resources that's associated with recidivism. For almost 3 years now, just about 3 years, we've been working to bring this approach across the map from Washington State, where it was born, all the way across the map. We're working in 14 states now and are working officially with Santa Barbara County, our first county in California to step up to the plate, and are in discussions with 2 additional counties and hope to begin work in the next few months. Now, Results First is a capacity building initiative. So we don't take the traditional consultant approach where we come in, ask you to pull a bunch of complicated data, and then come back 6 months later with the report. Our charge is to train you in the cost-benefit methodology and then to help you use it. So to do this, first off, we provide the model software. All of the data that you collect and analyze to use with this approach through this model is housed in your county and stays in your county. We also train your staff in the approach through ongoing technical assistance to help you answer your own policy questions so you won't need us in the long run. We can also help you interpret your results and provide communications assistance to help you message your findings in a way that people will listen. So, what are our states doing? In the last year, very proud, 3 of our states enacted legislation incorporating Results First into their policymaking process. So that's 3 states up in the Northeast, Connecticut, Vermont, and Massachusetts, all created a statutory platform for continuing to build and use their Results First models. 2 of our partner states, Illinois and Iowa, use their models to analyze potential legislation through fiscal impact statements and bill analyses. And they they calculated that they avoided millions of dollars in costs this year by just taking a closer look at what potential legislation would actually cost them. 5 of our partner states use their models to target $28 million in funding for effective programs that they anticipate will return high rates on their investment. And that includes New Mexico, Iowa, Massachusetts, New York, and Vermont. Now, I've said Iowa a couple of times, so I'll dig a little bit deeper into what they've been doing. In Iowa, we're working with the Department of Corrections to develop the tool for adult criminal justice programs. And the department reported their results last year, and I'll give you an example each of how they've used this approach to cut and to build. So last year, their model demonstrated that their domestic violence perpetrator treatment program, their batter's education program in the community, the particular program that they're using, they found in the literature to actually increases recidivism. It's very hard to hear. So not only were they missing the mark in their mission of protecting public safety, but running this program through their results first model, they determined that for every dollar they're pumping into this program, they're actually losing $3 in the long run. So they went to the University of Iowa and they asked, please help us, we've got to come up with a program curriculum that actually decreases recidivism in this population. So the university developed the ACTIVE program, Achieving Change Through Value-Based Behavior, and are piloting this program in a handful of judicial districts. So the program is currently at 10-month outcomes, and they're seeing some positive results for recidivism reduction, and they're hoping to be able to roll this out statewide and replace that ineffective program. Now, on a positive note, Iowa's model demonstrated that their cognitive behavioral therapy programs in prison and in the community are inexpensive and effective. Best case scenario. That's the sweet spot for return on investment. They're seeing in both of those populations that for every dollar they're putting into these programs, they're seeing between $25 and $35 in benefits in the long run. Now, unfortunately, there just wasn't any additional funds this year for the department to be able to expand this program to meet their need. So the department got creative. They took their findings to the NIC, and they applied for and they received a technical assistance grant to receive training on T4C, Thinking for a Change. So through this training, they've been able to increase the number of staff who are qualified to provide the program. They've improved the quality of the program overall, and they've increased the number of slots for potential participants. That's a win. All without state funds, and all because their staff got interested in the fact that they're providing an effective program at really low costs. You can do all of this and more here in California. We've been working so far with community corrections partnerships, and specifically with probation departments, to organize and implement the results first approach in the counties. Our assistance in the model software is free of charge, and our goals with you are the same as they are with our state partners: to help you develop a county-specific cost-benefit tool and to help you develop your analytical capacity to use the program research that's out there, to use the data that you already have in the county, to be able to target your resources at programs that will be successful in your jurisdiction. And I love the charge that your CSAC president, Mr. Finnegan, gave you this morning to move away from approaches that don't work, to abandon them, and focus on approaches that do work. Now, I know we don't have time for questions today, but if you have any specific questions about the results first approach or how counties are interacting with us, please don't hesitate to reach out.